I'm here to introduce a presentation on the Open Humanitarian Risk Index, which is a collaboration of a number of entities. But before I do that, I should acknowledge some people in the room, in particular one person, that's Craig Williams from OCHA, sitting in the centre there, who is the father within OCHA and within the international humanitarian community of risk indexing, for want of a better word. Craig, thank you very much for all your work in this and coming today to be with us. I'll give the introduction, and then the real work will be done by Tom de Groove of the European Union's Joint Research Centre. What are we doing? First, we're doing this as a shared, transparent index with global coverage, and a couple of important points that make this a little bit different from some of the work that's gone on before. It has a regional and a subnational ability, so we can look below the national level and we can look cross borders at various risks. An important factor in a lot of our planning, particularly at the international level. And as well as that, there's a seasonal variation. So this changes, this index changes throughout the year, informing our planning in particular. Why do we need this? The important point in those slides is the commonality of a picture. So we're dealing off, as far as possible, a common view of what the risks are and where they relate to each other in terms of prioritisation, because that's one of the main reasons we're doing this risk indexing, to allow us to target what eventually will be very scarce, or inevitably will be very scarce resources. So a very important thing. I'll let you just read the other objectives and items that are on the screen there. There are a number of principles that we've used in development of this index, and it is in development, as you'll hear. First, it's global. Second, it's available, it's open. There's no proprietary issues involved with this index, and we're available to share it with any partner. It is based on a continuity system that involves a number of years of data, so it's not just an immediate hit of what is available on the day. Again, it's transparent. The data sources and the methodology will be available to anyone who wants to use it, and it's flexible. I might note that item about seasonal variation and being able to go beyond just looking at one country, looking down below at the subnational level and also at the regional level. There are a number of actors involved in this development, and where this partially came from is the Interagency Standing Committee sub-working group on preparedness, where we do support to the country level in terms of interagency preparedness, along with OCHA in particular. That's why you see these partners there. I co-chair that group with UNICEF's Michel Lepechu. So that's where we've been coming from, what roughly we're trying to do, but the real description is now over to Tom. Thank you.
Can I have the thing too? Thank you. More information will be able to find on some flyers here and on websites later. But I will illustrate a little bit what's behind the risk index. And it's inspired a lot by existing work already mentioned in OCHA of the global focus model, and parallel work that was going on since 2004 more or less in DG ECHO, also to prioritize actions with evidence-based data. So there are a number of projects out there that have looked really at characterizing the hazard, the vulnerability, and the capacity of a country using open available data. Now, the new thing here is that we don't have to look for this data and put it in a database, but the agencies that are collecting the data on the ground are partners in this and agreed to share this data in there. So we will have a very good set of data on refugees, on health statistics, on children, all this kind of data, which is very important to characterize the vulnerability and also capacity of countries. More and more this data is collected at subnational so we use this data available at subnational level and insert it in the methodology. Another thing that is new compared to other methodologies is that we really truly follow the risk formula, which is normally a multiplicative model where the risk is a function of hazard times vulnerability times capacity. And this has a number of advantages that we really believe in and we will implement in this index. It covers natural and man-made hazards. Vulnerability is mostly about the population, and the capacity is in capacity of emergency management. Another element we bring to this is that GRC has a role in many composite index. It has a strong expertise in composite index initiatives, including the Human Development Indicator in assessing the statistical soundness of these things. We do audits of these indicators to see if they're what elements are good and performing well. And this is built in from the start in this index, and it will make it a reliable and good tool. The seasonal was mentioned before. The seasonal aspect covers a few things. So here we see 12 images, which are basically the monthly instantiations of the risk index now. We take account of cyclone seasons, drought seasons, monsoon seasons, which effectively changes the risk of certain countries up and down across the world. And this is part of it. It's very necessary to plan ahead, a few months ahead, which many of the operational agencies have to do. So this accommodates that kind of need. At the same time, you can look ahead with forecasts. More and more science is able to forecast the weather patterns 6 months ahead, and all this can also be in here in a different variation of the index. Also for the vulnerability, but that's for later things, the vulnerability can have seasonal components like migration patterns of people and all. It can be included in the methodology. Very important are the pockets of humanitarian needs, where you have a certain region that is quite at high risk, but it's not confined by national borders. In this case, we need the data at subnational level and must be able to create pictures that go beyond borders and to have a coherent strategy for reaction. The methodology is always the same, so this has been defined as it can work subnational, seasonal, but the methodology, the basic methodology is the same. The index performs the same way. The ranking doesn't change if you add or delete certain countries or provinces in it. Another part of it is a more real-time part where we look at crisis. It's very hard with this index-based approach to get up-to-date data. Normally these data are published 1 year and they're actually available only the next year. We, in particular for whether or not a country is in crisis, this is very important to have real data. And also things like the number of refugees. Everything changes with higher number of refugees or internally displaced people. Having the agencies on board that are collecting this data will ensure us that we can catch this fast changing data in the index. It's an additional component, this crisis index. Like we said before, the base, there's a common base that will be used by all the agencies, including the GECO and the UK DFID. But each will fine-tune the index to their own particular needs, their own particular thresholds for intervention and all. And this crisis index is one of the additional elements can be taken into account. So where are we in this initiative? It's quite recent. We started only last October with these partners coming together, brainstorming ideas, and we have now, we come together. This is the first public presentation of this initiative where we invite other interested partners to join. Upcoming are some more partnership building, and particularly for us an important point will be in October, where we will present the first new model based, the first new index based on this new model within our working group, to hopefully finalize it by January 14. From that point on, we will produce it continuously. The data will be updated continuously in a web system, downloadable for everybody. More information you can find on a currently very draft website, the ORI at GRC, and more questions you can direct to the people here involved. Thank you for your attention.